Hi everyone, hope all of you are doing good. We as a group, we are going to present on collaborative group assignment part 2. I'm Isha Acharya. Let's move towards the why we choose postpartum lactating mothers. We choose postpartum lactating mothers to focus on mental, physical, and social well-being of the mother as well as child. Many mothers feels the social, cultural, religious barriers during the postpartum period as well as lactation period. The research shows that there is decrease in ratio of breastfeeding from initial admission to post-discharge period. Many new mothers experience the lack of family and partner support, and the family and partner support is the priority during the postpartum and lactation period. Let's move towards the definition and parameters. Whom we are taking? We are taking the lactating mothers who are of age between 15 to 45 breastfeeding from birth to 2 years, where we can find the lactating mother in the diverse location in the community. Which demographics we are considering? New as well as experienced mother on the basis of education, family, socioeconomic condition, cultural diversity. The major health concern in the lactation period is physical as well as mental and emotional and the social well-being.
Hello everyone, I'm Shridhana Chaudhary. I'll be continuing the assessment methods for the lactating mothers, which are used to gather comprehensive insights about the challenges faced by postpartum mothers. The first one is interview, which helps uncover individual experiences with breastfeeding, mental health issues like postpartum depression, and societal or cultural pressures related to motherhood. The second one is focus group discussions, which explore group dynamics and the shared experiences of lactating mothers. It also sheds light on common barriers to breastfeeding, such as cultural beliefs or emotional struggles. Third one is Winsell survey, which is a type of observational assessment method where researchers observe a community or environment by noting features such as infrastructure, community resources, and cultural practices. So, for lactating mothers, researchers could observe community areas where new mothers gather, like, like parks, clinics, or community centers. The aim of the Winsell survey would be to identify environmental or societal influences on breastfeeding, such as the availability of the support services, attitudes toward breastfeeding in public, and community resources for postpartum mental health. And the last one is Edinburgh Postnatal Depression Scale, which is a widely used screening tool to identify symptoms of postpartum depression that consists of 10 questions about mood, anxiety, and emotional well being, and is typically administered to mothers in the weeks after childbirth, which helps to identify individuals at risk for postpartum depression, which is crucial because untreated postpartum depression can interfere with breastfeeding and maternal bonding.
Hello everyone, myself Roshali and I will talk about rationale for us the assessment and information sources. So the rationale is this assessment will identify challenges and supportive factors influencing breastfeeding within community. The findings will help in policy development, promote healthcare support and expand the access to lactation support. Information sources are government health agencies, local public health units, healthcare facilities, and community organization. These information sources will help to give information on uh, breastfeeding, health education, breastfeeding rates, as well as supportive programs. Thank you. Let's talk about community strengths and challenges. So, in the strengths, like presence of lactation consultants and supportive health policies. Lactation consultants play a crucial role in supporting breastfeeding mothers. Many healthcare institutions and government bodies promote breastfeeding through policies such as baby friendly hospital initiatives, extended maternity leave, and legal protections for breastfeeding in public spaces. Peer support groups and community programs. These programs offer a sense of community, allowing mothers to share their experiences, seek advice, and receive encouragement, which can improve breastfeeding success rates. So, now let's talk about challenges. Limited workplace accommodations. There is a lack of designed lactation rooms, flexible break times on a site childcare in workplaces. Social stigma and cultural beliefs. Everyone has their different cultures and beliefs. Some in some cultures, breastfeeding in a public is not is forward upon, and certain beliefs may discourage exclusive breastfeedings. Lack of knowledge regarding breastfeedings. Many new mothers, family members, even healthcare professionals may have a limited knowledge regarding the breastfeedings. Thank you.
Hello ma'am, myself Devansh Pandya, and in this video I'm going to discuss about some of the institutions that helps the lactating mothers community. In that, first one is community health centers as well as lactation clinics. So this provides free consultation with specialists and postpartum care clinics. And then second one would be public health programs. So this municipal health units offer prenatal classes as well as nursing home visits. Then the third one is non-profit organizations. So in this, organizations such as LACHE organizations are helping mothers 24 by 7. And the fourth one would be hospital based services, which hospitals provide critical postpartum support. And the fifth one is peer support networks. This support groups reduces the isolation through shared experiences. Thank you. Hello ma'am, myself Devansh Pandya, and in this video I'm gonna discuss about some of the health stakeholders as well as uh, gatekeepers of the lactating mothers community. The first was include healthcare professionals such as nurses, midwives, and many more. And second one is public health workers, and the third one is community organizations which might be semi-government or government. Then fourth ones are mothers and caregivers itself. Thank you. Hello ma'am, myself Devansh Pandya, and in this video I'm going to discuss about some of the communication strategies that can use to discuss the issues. So first one are interdisciplinary meetings as well as educational workshops. This can be used for the healthcare professionals. And second one is statistical data as well as research findings. And the third one is campaigns. So campaigns are basically used for the community groups. Then the fourth one is focus groups. So the focus groups here are tend to say about the mothers as well as caregivers. Thank you.
My name is Stella. I'm going to talk about voices of postpartum lactating mothers which are not heard. These are mothers with low socioeconomic status who have access to limited health care because of the resources. Mothers living in rural or remote areas, because of their geographical isolation, they are restricted to healthcare professionals. We have mothers with disabilities. Physical or cognitive disabilities can create additional challenges in assessing lactation support. We have mothers who are LGBTQ, that is transgender. They encounter discrimination or lack of understanding from the healthcare providers. We have mothers experiencing postpartum mental conditions. These conditions like depression and anxiety can make it difficult for them to talk about their needs and seek help. We have mothers who are teenage. They are often overlooked and lack access to proper education and support. We have immigrant and refugee mothers who have language barriers, cultural differences, and lack familiarity with the healthcare system. Looking at the assessment methods we used, it was more of a communication kind of where you meet with the community. So the data is very valid and is very specific and very objective, giving a very reliable data to the results. There is also community involvement where you go and meet the community as you assess their needs, and therefore you're able to identify which resources and where the gaps are. When we go to the limitation, there is biasness because you might not be able to assess the community in a uniform way. There's also a language barrier in some areas where people have different races and not able to understand each other. There's also lack of access to the marginalized areas because of how remote they are. This also kind of data gives a momentum report because it is objective, and therefore you're not able to get a background data, retrospective data from the previous encounters. So in view of that, there are other alternative approaches in assessment methods, like the walking surveys, where you don't have to be in the car, you need to walk and do your survey. There's also the asset mapping, where you identify and document the existing strengths and resources. There's also qualitative data collection, which is more descriptive as compared to the quantitative kind of data collection, where you analyze the existing data. You can also involve the community in listening and sessions where you meet them person to person and do the collection of the data. Thank you.
And now let's look at into advocacy considerations versus promoting breastfeeding support programs. Advocate for policies that ensure access to lactation consultants, peer support groups, and educational resources for mothers. The second one is addressing cultural and social barriers. Campaign for cultural sensitive breastfeeding education to address myths and stigma. Advocate for public awareness initiative to normalize breastfeeding in various settings. And the last one is mental health support. Advocate for routine postpartum mental health screenings and accessible counseling services and promote community-based supports networks to reduce isolation to new mothers. Now let's look into the ethical consideration. First is informed consent and autonomy. Mothers should be fully informed about breastfeeding benefits and challenges without coercion. Respect individual choices. Second is confidentiality and privacy. Protect sensitive health information and ensure private and comfortable places for breastfeeding or pumping in public and healthcare settings. And the third one is non-discriminatory and equity. Avoid bias based on socioeconomic status, race, or age when providing support. Ensure marginalized groups receive equitable access to resources. And last one is beneficence and non-maleficence. Healthcare providers should prioritize the well-being of both mothers and child, avoid interventions that may cause unnecessary physical or emotional harm. As a group, we learned that lactating mothers are often struggle with physical and mental health challenges, while facing social stigma and financial barriers, especially in marginalized groups worsening an already difficult transition to motherhood. Also, we learned the significance of employing various assessment methods for lactating mothers to effectively determine their needs for assistance. Lastly, collaborating has highlighted the importance of teamwork and various viewpoints in community nursing, stressing the necessity to tackle the social determinants of health and advance health equity through an inclusive and complete approach. That's all. Thank you for listening.